Did you know that pneumonia is one of the leading causes of illness in young children, and yet its early signs are often mistaken for something less serious? Recognizing these symptoms early could be life-saving for your child. In today's video, we'll be covering the key symptoms of pneumonia in babies and children, how to spot them early, and when it's crucial to seek medical help. Let's dive in. First, let's quickly understand what pneumonia is. Pneumonia is an infection in the lungs, often caused by bacteria, viruses, or fungi. When the lungs are infected, they can fill with fluid, making it harder for your baby or child to breathe. Since babies and young children have developing immune systems, they are more vulnerable to infections like pneumonia. That's why recognizing the early signs is so important. Let's now talk about the key symptoms you should watch for in babies. First, pay attention to their breathing. Fast or labored breathing is one of the most telling signs of pneumonia. If your baby's chest is moving rapidly or it seems like they're working harder to breathe, this could be a red flag. You might also hear grunting or wheezing sounds as your baby tries to breathe. These noises can indicate that their lungs are struggling to take in enough air. A persistent or worsening cough is another important symptom. Unlike the occasional cough from a cold, pneumonia-related coughs can be more frequent and intense. Next, keep an eye on their temperature. A fever is common with pneumonia, and it may be accompanied by chills or sweating. Babies with pneumonia can also become unusually fussy or irritable. If you notice more crying or discomfort than usual, this could be a sign that they're not feeling well. Loss of appetite or difficulty feeding is another symptom to look out for. Pneumonia can cause fatigue, and your baby might not feel up to feeding as they normally would. Lastly, a very serious sign is cyanosis, where your baby's skin or lips may turn bluish. This happens when they're not getting enough oxygen and requires immediate medical attention. For older children, the symptoms can be slightly different or easier to recognize, since they can tell you more about how they feel. Chest pain or difficulty breathing is a common sign. If your child complains about pain in their chest or has trouble breathing, take it seriously. Fatigue and lethargy are also typical. If your child is unusually tired or weak, it may be because their body is fighting off an infection. In older children, the cough might be productive, meaning they could cough up mucus or phlegm. Like babies, rapid or shallow breathing is another sign to watch for. So, when should you contact a doctor? If you notice any of these symptoms lasting for more than a few days, or if your child's breathing becomes labored, it's time to seek medical care. High fever, dehydration, or worsening symptoms are also reasons to visit the doctor immediately. Remember, early diagnosis can lead to better outcomes and faster recovery. If pneumonia is diagnosed, your child's treatment will depend on whether the infection is bacterial or viral. Bacterial pneumonia is typically treated with antibiotics, while viral pneumonia may require supportive care like fluids and rest. It's important to follow the doctor's instructions carefully, especially when it comes to completing any prescribed medications. Prevention is always better than cure. Vaccination is one of the most effective ways to prevent pneumonia, so make sure your child is up to date on vaccines like the pneumococcal and flu vaccines. Teaching good hygiene, like frequent hand washing, can also reduce the spread of germs that lead to pneumonia. Lastly, proper nutrition is key to building a strong immune system that can fight off infections. Pneumonia can be serious, but knowing the symptoms and acting quickly can make all the difference. If you notice any signs, don't hesitate to consult a healthcare provider. Thank you for watching. Be sure to subscribe for more helpful health tips and videos. Remember, being aware of these symptoms could help keep your child safe and healthy.